Welcome to Peak Performance and our Facebook Live event where we will discuss ways to keep your feet healthy. Um, my name is Jim Ewalt. I'm the owner of Peak Performance. In our discussions today, we will discuss foot and ankle health, foot and ankle injuries, foot and ankle abnormalities, and ways to prevent those injuries and treat those injuries. I've been doing this for 32 years. We're here in our Fit Lab today, and I'm here with
Dr. Constantinopoulos. I'm one of the foot and ankle surgeons at UnityPoint Clinic, foot and ankle.
Um, in our first episode today, we're going to discuss one of the most common related foot causes of foot pain, and that is plantar fasciitis. So to kick us off here today, Dr. Antonopoulos, what is the plantar fascia? How does it work, and why is it so prone to injury?
The plantar fascia, it's a ligament in your foot. It attaches to your heel and goes all the way up into your toes. Its function is to provide stability for your arch and to protect your arch. It functions as we're walking, like I said, to help stabilize that arch. So one thing you can see is when you first get out of bed in the morning or when you're walking, normally biomechanically, when we're walk, your arch wants to collapse a little bit, and so that plantar fascia will tighten up so that it can protect your arch. What can happen in some people is that it can be very, very, very tight. So when it goes to tighten up to protect your arch, it can pull on your heel bone and causing a lot of inflammation and a lot of pain. The treatment is twofold. It's multifaceted, but twofold mostly. Number one, you want to get rid of a lot of that inflammation. And once you get rid of that inflammation, that pain will go down. However, it's more important to treat the underlying problem. The number one underlying problem is your Achilles tendon. The Achilles tendon, the correlation there is your Achilles tendon attaches on the back of your heel there. It also has fibers that go around the heel and they attach to that plantar fascia. So when we have a really tight Achilles tendon, you can have pain in your Achilles tendon or your plantar fascia, and the longer that you have these things, you can even get it in both. So stretching not only the plantar fascia, but your Achilles tendon as well is very, very important. On top of that, as I said, treating the inflammation, so anti-inflammatories, but more importantly, wearing a good solid shoe and inserts also help treat these things as well.
Oh, good, good. So, are there any certain types of calf stretching that should be done?
Yes.
Like the soleus and the gastrocnemius
Yep,
individually or together?
I prefer together. So your Achilles tendon is made up of two different muscles. One is the gastrocnemius, which is the outer muscle that we can all see when we're walking, and the inner muscle called your soleus. The gastrocnemius, it actually attaches above your knee, and the soleus below your knee. So when you're doing a lot of these calf stretches, it's really, really important to keep your knee straight so that you're stretching the gastroc and the soleus, and then you're stretching the Achilles tendon as well.
Great, great. So what about things like spiky balls or I always hear to eliminate adhesions in the plantar fascia.
Absolutely. So let me talk about the stretching first, and then we'll get to that because
Okay.
they're kind of related. So some stretches that you can do for your Achilles tendon is, I don't know if they can see me, is you can go up to a wall, put your foot on a wall like this, and just lean forward, which you'll feel it in the back. Another really good stretch is when you're laying in bed. Stretching first thing when you get out of bed in the morning is the most important thing. It's going to make that morning better, and it makes the rest of the day better. So one really good stretch that you can do is if you cross your legs, you bend your toes back. So the reason why we bend our toes back is because it'll tighten up that plantar fascia because of that connection there. And you can rub along your arch there to loosen that up. That's where these things come in. It's very similar where you can rub your foot over it and it helps loosen up that plantar fascia. A lot of times what can also happen is the longer we have plantar fasciitis, we can get little micro tears, not only at the insertion, but along your arch as well. And these little micro tears, they heal, but unfortunately they heal with thickened scar tissue. So then you can get these little masses along the arch of your foot, which are called plantar fibromas. And plantar fibromas, a lot of times it is a surgical problem. However, we try not to remove them because you still got to treat the underlying problem. If you go in to remove them, they can still get those tears. And they have a really high recurrence rate. So then it's back to the stretching, the little rollers, the inserts, and the shoes.
You mentioned when they step out of bed in the morning, should they step into something with support?
Absolutely. I always like to tell my patients, do your couple stretches before you get out of bed in the morning. Put your foot in a pair of shoes or even a pair of slippers with some inserts or even a pair of sandals, which I highly recommend these sandals. They're a very good supportive sandal. There's a lot of sandals on the market. Most of them are not very supportive. You're looking for something that's a little more solid, that has an arch in it, that really helps support that arch for you.
Sweet. So getting into ways to prevent plantar fasciitis, what would be like the top 3 things that someone could do to prevent plantar fasciitis?
Stretching is up there. Again, wearing really, really good shoes. You know, if you're going to be out working out, wearing a really good solid shoe, which Jim will be able to talk to you here in a little bit about things like that, and wearing a good insert. Not everybody needs an insert, but many people do.
So like, since we're discussing inserts, for repair, do we need to keep that arch high, or should we baby it with cushion?
I really like inserts like this. So, you know, there's many different types of inserts. A lot of them, you know, you can go step on the little thing at another store, and you can get custom inserts. The problem is if you get an insert that they're really flexible here, it doesn't help support that arch. So, you know, there's 3 different types of feet that you can have. You can have a flat arch, you can have a normal arch, you can have a high arch. With a flat arch or a flat foot, your hind foot is flexible. So what you do is you put an arch in it because your hind foot will accommodate that arch that's in it. Initially, you probably are not going to like it, but over time it gets better and better and better. Now a high arch, your rear foot or your hind foot it's more rigid. So it's a similar treatment, but different principles. So the principle for a high arch foot is you bring the ground up to it to support it. You don't want to put a lift on the outside to try to bring that in when you have a high arch. You just want to support that foot because it's more rigid.
It's like a softer arch then, or still something kind of
no,
rigid?
I think these
Okay.
power steps are
Okay.
very good.
Okay.
And, you know, the best arches they have is they don't flatten out. Because if you think of your body weight, if they flatten out very, very easily, well, it's not going to do much support for you.
Okay. In regards to footwear, we have, it's been known since as long as I've been doing this, is 32 years, that with plantar fasciitis, we need a shoe that's relatively stiff in the toe. So the shoe shouldn't be able to bend in half, and then also have what's called torsion. And so if you can take your shoe and take the toe and touch the back of the shoe with it, or if you can take your shoe into a figure 8, there's not enough support or torsion in the shoe to support the plantar fascia.
Correct. And along those lines, you know, what I like to say is in a shoe that bends in half or you can squeeze out like a sponge, in that shoe, your foot is controlling your shoe. You don't want your foot to control your shoe. You want your shoe to control your foot.
Good way to put it.
So a very good, stable shoe, then you're able to do what you want, and it reduces a lot of these problems that we have in the foot and ankle.
Yes, when shoes come into the store and we see the new shoes for the next year, one of the first things we do is a flex test. You know, there's been shoes we've carried over the years that are no longer on the wall because the shoes are becoming less supportive. And so we want to make sure that we're selling a shoe that's going to be right, you know, for the foot type, number one, but also prevent injury or in those cases.
I think the biggest thing is you pay for what you get. You know, you can go buy a $20, $30, $40, $50 pair of shoes. Well, you're going to get a $20, $30, $40, $50 pair of shoes that you're going to have, that you should be replacing about every 2 to 3 months. Now you buy a nice quality shoe, it lasts a lot longer and it's more supportive for you. And I know you guys have a really good fit process here. Do you want to kind of tell them about that?
Sure, yeah. What we like to do here at Peak Performance is what's called a 5-point fit process. We look at your arch height, the alignment of your 2 lower leg bones, called your tibia and your fibia, and how they stack on top of your foot. We track your knee with the end of your foot. We watch you walk. And then we do what's called a one-leg engagement test, where we have people stand on one foot and do basically a one-legged squat to engage the ankle, knee, and hip at the same time to see how much knee drop we get with that. Then on our wall, our shoes are color-coded by support. Our shoes are red, yellow, orange, blue, and green. So whatever your foot type is, then there's a shoe type for it.
Do you want to kind of talk about like the different types of support?
Our red category shoes are our most supportive.
Okay.
That'd be like a Gaviota, an Ariel, a Beast from Brooks. We get into our yellow category shoes where like the Hoka Rahi is coming into play there. Asics 4000 are two of the more supportive shoes in that category. And then we step down to what's called our guidance category for somebody who needs just a little bit of support or on their longer runs start to fatigue. So that you go into a little more pronated state when our hips start to get tired. And popular shoes there are the 2000, the Keanu, the Adrenaline.
Okay.
The Adrenaline comes in a lot of different colors, so that's popular there. Then we have what's called our wide base shoes. Those are blue category, where the bases of the shoes are wider. So if you see the difference between these two shoes and how wide they are on the base, they make great standing shoes. Mm-hmm. People on their feet all day.
Okay.
And people who kind of stay to the outside. Those underpronators, that bow-legged people that can tip to the outside. And then we have our green category shoes or our neutrals.
Okay.
So it's very efficient.
Yeah.
Which is kind of uncommon, but we do see it from time to time.
Well, one thing I see quite often where, people come see me with, hip pain or knee pain, but their foot's doing fine. And what a lot of people don't realize is with a nice solid shoe, with a nice supportive insert, if you align that foot, if you have a flat foot or a high arch foot and you align that foot and you support that foot, well, then your knees are going to start feeling better because you're walking how you're supposed to. I always like to say it goes up the chain of command. You take care of the base, then as we go up, that it starts to feel a lot better as well.
It's always our goal to put the customer or patient's foot and leg in what's called preferred movement pattern. When we put the shoes on, we retrack them again to see if that knee's now coming right off the end of the shoe.
Okay.
So it's always our goal to get them as efficient as we can, with the shoe or with the possible insert that or orthotic that we get from you guys.
And
so.
you also work a lot with like runners and things like that.
Track and cross country are our two of our biggest seasons. There's a fair share of runners in the Siouxland area and marathoners in the Siouxland area, that come to see us to keep them healthy.
Great.
So moving on here, there's a lot of what I call, for lack of a better term, misconceptions. One of the things that I see here, and I think you may see it as well, is Dr. Google. And how they are so much smarter than what you are.
Yeah, Dr. Google is not always right. I think the biggest misconception I see is people calling it a heel spur. In all actuality, it's the plantar fasciitis that is causing that pain. So what happens is the plantar fascia attaches to that heel bone, and it's pulling because it's so tight. And over time, your bone gets sick and tired of that constant pulling and tugging. And so it builds a little extra bone there to try to lengthen your plantar fascia. Unfortunately, what your body doesn't realize is that's a horrible way of trying to lengthen your plantar fascia. However, that heel spurt doesn't cause any of the pain. It's usually about 1 to 2 millimeters in size. It's parallel to the ground. And whenever, we have to go in and do, surgery and things like that, usually do not even address the heel spurt. Because again, you address the plantar fascia by the stretching, the shoes, anti-inflammatories, you reduce that, people feel great, even though they still have that heel spurt.
Another thing that we get quite a bit, since they have heel pain, they want to really put a lot of cushion on the heel.
It's actually the opposite of that.
Okay.
So a lot of people, again, you hit the nail on the head, is when they have that heel pain, they think they need something super, super soft. In all actuality, you want something a little bit harder because, something like this where it supports that arch. So you want something harder so that your foot doesn't flatten out and allows that plantar fascia to relax with every step that you're taking. Buying those like gel inserts and things like that, they actually don't do much for you at all.
I have customers that come in and have, relatively flat feet, and I have plantar fasciitis because I have flat feet. Is that true?
It's a big cause because people with flatter feet, they also always have a tight Achilles tendon. They go hand in hand. So yes, having a flat foot can absolutely lead to plantar fasciitis, but also having a higher arch foot because when we have a higher arch foot like this, all the ligaments and tendons on the bottom of your foot are tighter. So it doesn't matter what foot type you have. everybody can get plantar fasciitis. I do see it in a lot of athletes as well, because a lot of these athletes, they are stretching. However, they're ignoring the most important thing, that Achilles tendon. That Achilles tendon causes so many problems in the foot and ankle, and it's often ignored. Where a lot of this stuff, it can be resolved with just some stretching of that Achilles tendon, a little bit of stretching of that plantar fascia as well.
Is surgery always needed for plantar fasciitis?
No, if you look at the literature
Or I
about,
should say, is it necessary in cases?
in some, yes.
Okay.
So if you look at the literature, about 10 to 15% of the people need surgery for plantar fasciitis. Now, there's a couple different ways that you can do surgery. One, if they have a decent Achilles tendon where it's not really tight, you can just address the plantar fasciitis, which I'll talk about here in a second. But a lot of people do need a lengthening of the Achilles tendon of the Achilles, and then also a release of the plantar fascia. And so the great thing about our clinic is that we are addressing a lot of these things actually in our clinic. I'm actually able to do surgery on a lot of these patients in our clinic. So rather than taking them to the operating room and having it do surgery, we can address it in the clinic, it's great for the patients.
More convenient.
I think the biggest thing is it's a lot cheaper for the patients. But what the surgery involves is you actually go in there and you just release about 40% of that plantar fascia. And so what it does is it lengthens it out and it heals in that lengthened position.
Oh, okay.
And so the other good thing, if there's a good thing about any surgery, is you're up and moving pretty quick. If we're having to address the Achilles tendon and the plantar fascia, you're walking right away. You're in a boot for 3 weeks. And then you slowly start getting back to activity. The ones that I've been doing in the office setting, they're walking right away in a little black post-operative shoe. And then at 1 week, when I see them in the clinic, if they're doing well, we start to get into shoes, and then we get back to activity. So surgery, it's not, nobody wants to undergo surgery, but this type of surgery, it provides a ton of relief for people, and we get you back to activity pretty quick. And with me and my two partners at our clinic, our opinion is surgery is the last resort. It's after we've tried all these things and it's just not working. I've also noticed is the people that let it go longer and longer, 1, 2, 3, 4, 5 years.
Years, yes.
They're the ones that more often lead to surgery. And the problem is a lot of times, after surgery, they're still having a little bit of discomfort. Well, it's because your body and your feet and your ankles and your legs have accommodated over time, and you're just used to that. And one thing that you can also see is the longer that you have it, you start to walk a little bit differently. People that have pain on the inside bottom of your heel start to walk out like this. And then it stresses other joints, and then you start to have joint pain. And so
You try to walk away from the pain.
Absolutely. And so I get a lot of people that come in, well, it started here, but I have all this pain over here and over there. And I tell them, I go, well, let's address this, because once we fix this, you'll walk better. All that other ancillary pain will go away.
Sweet. The kind of maybe, to start wrapping this up a little bit, we asked for questions in regarding to your different types of foot pain, and we've got a few responses here. So we're going to have the questions asked to us here pretty quick. Danielle?
Let's see. So how do you prevent plantar fasciitis?
Well, from a shoe standpoint, and like Dr. Antonopoulos was talking here, there's 3 main causes of it, in my opinion: tight calves, lack of midfoot support in shoes, and what's called excessive overpronation. Mm-hmm. That arch is overstretched. So, getting a shoe type that matches your foot type, a shoe with proper foot flex and torsion, and then like Dr. Antonopoulos was talking about, would be to stretch the soleus and gastrocnemius. Mm-hmm. They kind of keep that heel rotated back to where it's supposed to be.
Absolutely.
How long does plantar fasciitis last?
It doesn't last forever?
If treated, it shouldn't last forever. However, what I see often is, people come to us, we tell them all this to do, they come to you, they get the good shoes, they get the inserts, and then the pain goes away, and then they stop what they're doing. And then unfortunately, a lot of times it comes back, and it comes back with a vengeance, and it's a lot harder to get rid of. So I always like to say, once we start this stretching regimen, you're going to do it until you're not around anymore.
Are people becoming more flexible or less flexible?
Less.
Yes.
A lot less, especially athletes. Like I said, those Achilles and athletes, I see so many, and they're so tight because we don't properly stretch that Achilles tendon.
Is this specific to one age group, or who's mostly affected by it?
I would probably say, college age and above. Usually in the young kids, they can get heel pain, but it's because of growth plates. And again, the treatment's the same, stretching that Achilles tendon out.
All right, another question we got is, if I have a plantar fasciitis flare up, should I continue with my normal workout routine or wait until it's feeling a little better?
I always tell people, once we start the stretching regimen, once we start the anti-inflammatories, when you're going to work out wearing good shoes, you can do what you want to do. You just have to do these extra things to try to reduce some of that strain on that plantar fascia and the Achilles.
Should we limit the amount of high impact?
Not necessarily.
Okay. That's kind of one of the things I've heard. Yeah, that you should limit your high impact exercise.
You can, but the thing is, if I start limiting these athletes or, ones that are working out a lot, they're going to go crazy.
Tell me not to run.
Yeah, exactly. They're going to go crazy. So, I want people to be able to do what they want within reason. I always say, if it's hurting, well, back off a little bit, and try some other things, less impact, like an elliptical, a biking, swimming, things like that. While you're having a lot of pain, yes, absolutely that helps. But once it starts feeling better, start slowly getting back to your routine.
Still continue that cardio program, just a different way.
Absolutely.
Yeah, cross training is always important.
Yep.
All right, so when should someone come in to see you, Dr. Antonopoulos? Should they try some of these things on their own first, or should they come to
They
see you
can.
as well?
I always like to say the sooner the better, because the sooner you come in, the faster we can get rid of your pain.
Yeah, like we see those cases where they've had it for months and months and months. And,
I've seen years.
And years, and they've tried everything under the sun to try and get over this. And to me, there's three kinds of pain. There's pain that you can run through, pain that slows you down, and pain makes you want to stop. And if it makes you want to stop and sit down, you got to go see a physician.
Yeah.
You have to go see a physician.
And I always like, when I go over the stretching, the icing, the balls, the stretch, people look at me like I'm crazy. They're like, I've had pain for 5 years. This is all it takes. I say, yeah. And, they come back to me in about 4 to 6 weeks. And I always like to tell them, if you do these things, the vast majority of my patients come back in 4 weeks and they're about 70 to 80% improved.
That's good news.
There are some other things that you can try, like physical therapy. It definitely helps. You can do it in injections. In my opinion, an injection is not the first line of treatment. Because even if we do surgery on these things, you still have to stretch. And that's, as I've said numerous times, that's the most important things. And putting someone in a boot for this stuff, in my opinion, that's kind of counterproductive. You put someone in a boot, it can tighten the Achilles tendon even more. So that's, again, I rarely, if ever, put people in a boot for this. It's the shoes, the inserts, the stretching, the icing, the anti-inflammatories.
All right, another one that came through here. It says, I have a night splint, but it hurts my calf so bad I can only wear it about 30 minutes. Will more stretching help with this?
Absolutely. So a lot of people have those night splints. For me, I can't even sleep with socks, so I don't know how people wear that while they sleep. So I always like to say, wear those while you're watching TV in the evening, and then in the morning when you wake up, do your stretches. And then you're not having to wear the night splint overnight. And then as you do the stretches in the morning and then you do them throughout the day, it's going to get better and better and better and better over time.
All right. What other options are there for plantar fasciitis other than shoes and surgery? I think you touched on it a little bit with
The stretching, yeah. Again, the stretching and a good solid shoe. And, a lot of people, as a foot and ankle surgeon, I shouldn't tell you to wear sandals, but there are some decent sandals out there if you're adamant about it, ones that have a really nice arch in them that are supportive.
All right. What's the percentage of patients that you actually have to do surgery on?
About 10 to 15%. If you look at the literature across the country, it's about 10 to 15%. I would say in our office, probably closer to 5 to 10%.
Let's see here. How often should I replace my shoes if I have plantar fasciitis?
I always say the more pain you have, and the more often you need to replace your shoes. or the more prone you are for injury, the more often you should replace your
Well,
shoes.
and how active you are.
Exactly,
If
yeah.
you're running every day, 3, 5, 6 miles, for me, I would say probably every 3 to 4 to 5 months, getting a new, and you might even say sooner, but 3 to 4 months if you're really, really active. If you're not as active, once or twice a year.
It's not uncommon if you use it as a work shoe to walk 5 to sometimes 12 miles a day in a shoe. People will buy tires more often than they replace their shoes. They rotate their tires to get more life out of them, and those types of things. In a running shoe, anywhere between 400 and 500 miles, that's if the shoe type matches your foot type. If they don't, you'll get less life out of the shoes. From a walking standpoint, you can typically get 500 miles out of the shoe if it's the right shoe for your type of foot.
So I personally can't wear athletic shoes to work every day. What are some dressier options that would be good for me?
Again, the same type thing. Find a shoe that just bends in the toe. To be able to support that arch in a better position. If you have to wear a dress flat or something, a little way more dressier than an athletic shoe. Now, if the liner in your dress shoe can come out, then we can put a full length insert into it, to support the arch better. If it doesn't, then we got shorter options that can go from shoe to shoe to shoe real easy.
I hate to say it, but female dress shoes, they're hard to find. Really good female dress shoes. They really are. I mean, they really, really, really are.
Yeah.
A lot of it is, I hate to say this, for looks, where they're just not supportive at all. I actually really like this insert in there because it's nice and thin and it can fit in a lot of shorter shoes.
The industry right now is heading more towards fashion versus function in footwear. And typically when you go more towards fashion, we do lose support in the shoe.
Jim, this question's for you. Are compression sleeves helpful for plantar fasciitis?
In cases, yeah, I'm a big fan of compression. Compression does two things: aids in support, but also increases circulation to the area. So wherever you have pain, you have inflammation, and ways to relieve inflammation with anti-inflammatories, or ways to compress that to get the inflammation out, so you can get new oxygenated blood, coming into the area. But I also like the plantar sleeves. It's a night splint.
Yeah.
It's easier to sleep in. It keeps the inflammation down overnight. That first step out of bed in the morning is a little less painful. Always do the pre-morning, the before you go to bed stretches, as I call them, and then step down into something supportive. But they can help.
Our body heals by inflammation, and unfortunately, gravity always wins. So your feet, your legs, they're always going to have a lot more inflammation in them. And so the more you're active, the more you're doing. When you have these things, the more inflammation you're going to be getting. So I'm a huge advocate for compression stockings. We do not wear them enough. I try to tell the vast majority of my patients that the compression stockings help immensely. A lot of us, we get home at the end of the day, our legs are achy, our legs are tired. Compression stockings help that a lot.
All right, I have one final question for you guys. What athletic or everyday shoes do each of you wear?
Oh, I'm currently wearing these.
Yes. I am blessed. I'm in the business. I've been doing this 32 years. I have an arsenal of shoes. But shoes I gravitate to almost 99% of the time are shoes with foot-shaped toe boxes. I'm a big advocate of toe splay. To me, it's a healthier foot, better circulation of the foot. Nerves don't get pinched off. My big toe engages more. Since I've gone to foot-shaped toe boxes, like in Topo or the Ultras that I wear, my bouts of plantar fasciitis are gone. They're also lower drop, so I'm stretching with every step.
Yeah.
Yeah.
I along with these Hokas, I personally like to wear Asics. Brooks are a very, very, very good shoe as well.
Well, and any more questions? Well, then we'll wrap it up here. Thanks for attending our Facebook Live event. We're going to plan on having more of these in the future to discuss, like I said before, the other types of foot and ankle ailments. And any comments or any questions you have, we'll answer those off the air. But thank you for attending. And any last words?
Here at Peak Performance, they're amazing. If you have any for us, we're at the UnityPoint Clinic, foot and ankle. We have 2 locations currently, one out here at Sunnybrook, one over by the hospital, and we will also be in the Dakota Dunes in the future.
Oh, good for you. Good for you. Well, thank you everybody for coming.
Should I hit end?